Dr. Greg here. Today we're talking about shoulder pain and neck pain. I'm going to separate the two straight away because they're often joined together or confusingly and wrongly diagnosed. When we refer to the shoulder today, we're going to be referring to it in terms of a ball and socket joint. So this part here, it's like that, and it's called the glenohumeral joint. Now it's a socket here with a ball there. It's the most mobile joint in the human body, and it allows you to perform so many great activities, sporting related, everything you do. Think of all the types of directions you put your arms into each day. That is thanks to the shoulder joint. Now the shoulder is anchored to the spine, would you believe it, by the scapula, or what we call the shoulder blade. Have you ever heard of someone say they've got chicken wings and the likes? That actually means that they've got poor stabilization. So that means their shoulder is not hanging into the spine like it needs to, and that means the shoulder moves around without as much protection. The same goes at the front of the body, which is the second anchor point, which is what we call the clavicle or the collarbone. Most people refer to that one as. Now it holds the shoulder at the front, and at the back we've got the shoulder blade or the scapula. Now when these two are functioning properly and holding very strong, that shoulder is quite robust and it's not as prone to dislocation or wear and tear injuries, which is a most common one is probably a rotator cuff like injury. Or do you just get the common knots where you've constantly got tension in around this area here? Now the common knots up in this area aren't exactly related to what we refer to as shoulder pain. They come from what we call neck pain, which can attribute to shoulder pain and not vice versa. So the neck is separated into 7 segments on the spine. So we've got the cervical vertebra from C1 to C7. And coming out of these areas, we've got nerve roots. Now these nerve roots, they're responsible for supplying all of the muscles and blood supply and giving the feedback of information on where to position the shoulder joint relative to the body. So if there's any pressure on these nerves or anything like that, that's going to affect the way the shoulder positions itself. It's also going to determine whether or not your body's under increased tension. Those constant knots that never go away, you can rub them as much as you like without any sort of resolve. That's usually the case when you have increased pressure or joint disruption going on within the neck. So it's best to look at the neck and the shoulder whenever you are having your shoulder, and whenever you have experienced shoulder pain, get your neck and shoulder examined. If you're ready to make that step, please contact my office on 0889421920, and I'd only be too happy to give you a more personalised diagnosis and explanation. Below you will find a report which has got a lot more detail regarding shoulder and neck related disorders. Please click on this link below and I will have my staff mail it out to you straight away. Have a great day.